Very good morning to all of you. It's quite an honor and a privilege to be with all the health policy maker, health practitioners on this health day, where the theme "My Health, My Right" is rightly chosen for this year. Now, actually, to me, this theme serves as a clarion call, reminding us of the intrinsic rights every individual has to health and well-being. If one has to translate Sustainable Development Goals theme, no one left behind, that actually gets translated in the context of health into my health and my right. Now, of course, when we talk of Pakistan, we know the challenges in health sector are there. And that's where perhaps we need to broaden this discussion that this year's theme, it actually takes us beyond healthcare. So when we talk of health, it encompasses physical health, it encompasses mental health, it encompasses social well-being, it encompasses right to earn a livelihood so that we can get this nourished food that can get assimilated into our body and result in our food security. It encompasses our right to clean drinking water and sanitation, again, something which is extremely important to for health. So in the context of Pakistan, where after 18th Amendment, of course, healthcare sector is now a mandate of provinces, the notion health and ensuring this right to health is something which is very much a fundamental responsibility of state. Although our constitution, it talks of taking care of those who cannot earn their livelihoods due to infirmity and due to sickness. But I would suggest that this year's theme reminds us that it's not only about infirmity and sickness, it's actually health is a right. And for this, we need to actually start a dialogue, a shared conversation between the government and people, and the governments, provincial governments, as well as the federal government and the citizens, because it's incumbent upon all governments, whether in provinces or in federal government, to make it both accessible and resilient, the provision of healthy life. Concurrently, the citizens, they must be proactive stewards of their health, advocating for their rights and contributing to a health-conscious society. And of course, the webinars like today, that Dr. Razia Safdar, Pathfinder, and all our partners, they have organized that would help in broadening the advocacy for this health-conscious society. And with this, I actually look forward to all the recommendations, all the knowledge that would be shared today. And we can assure you that whatever would be discussed here would get converted into policy paper that will be sharing with the relevant quarters and relevant circles, both in federal government as well as in provincial government, so that we can have a better health policy and we can play our role towards a health-conscious society and ensuring that health becomes recognized as a fundamental right in Constitution of Pakistan. Thank you very much once again for joining us.
Thank you, Dr. Abid, for your thoughts on it. And you very rightly said that we need to think beyond health sector as well. to achieve individual as well as community health, to make a health conscious society, and to bring it as a fundamental right of the human beings. So now I will just go through a presentation just to highlight about the what is right and what is the freedom and what is the entitlement, just to bring the discussion directed. So, I think this will involve everybody on attending. So, I think my health, my right is a very important topic, and it gives us a right to health is not only health related, but it is related to the other human rights. And it is legally binding commitments of the governments, countries, and globally. And this is it is enshrined in the international human rights instruments, and it has the right to the highest. That means every individual has the right to the highest attainable standard of the physical and mental health, which needs so the countries has to make the legislation, policies, and the universal to make the universal access to the quality, affordable, equitable access to the health services. And very important is to lessen the disparity, or to delete to obliterate the disparities of like poverty, stigma, and discriminations, to achieve to bring the right to health. So there are different human rights treaties all over the in which every human treaty includes the health right as well. For example, the most important is International Convent on Economic, Social, and Cultural Rights, and that speaks about the entitlements and the freedom, and elimination of all forms of racial discrimination, while discrimination against women, and Convention on the Rights of the Child, that is under Article 24, and International Convention on Protection of the Rights of the Migrant Workers as well. And the very important is, which recently Pakistan is working on it very aggressively, is rights of the persons with disabilities. So all of these treaties talk about the health as a primary concern. So when we talk about the freedoms and entitlements, that is according to the International Convent on Economic, Social, and Cultural Rights, freedoms are the right to control one's health and body, including sexual and reproductive rights, to be free from the interference, like free from the torture and non-consensual medical treatment and experimentation as well. So this is a broader theme. And what is the entitlements? That is the government's state responsibility. So that includes the right to access to quality health services without any discrimination. And the state has to develop and implementation right, compliant, integrated, accountable health systems, and addressing the underlying, as Dr. Abid Suleri has said, that addressing the underlying determinants of health, like WASH, one of the example. So for all these, we need to have a human rights based approach. So it is the mainstreaming fundamental human rights principles and the standards, which are non-discrimination, participation in planning techniques, accountability of the health systems, availability of the healthcare, accessibility to the healthcare, and assessing like the monitoring of the healthcare, and acceptability. That means which is accepted to the local population or the communities, and it is patient centered. And above all is the quality of care, which is the technical as well as the perceived quality of care. So every individual has the right to decide on its treatment, decide to his privacy or his or her privacy, decide to say no to the treatment or to the yes to the treatment. But this is somewhere sometimes it becomes, and it has the it should have the highest quality of the health, and everyone has the autonomy on its body or its way of life. So very important is like these days we are passing through a difficult phase. We have the conflict and emergencies in different ways. Like, for example, previously in 2022 and 23, There were emergencies in Ukraine and other areas, the war, and now we are having the war in Gaza. So though the international humanitarian law cover all these health health in conflict areas, and according to the law, the health workers, hospitals, and ambulances should never be targeted. But what is the situation, and what is like we need to advocate about? We will ask about it to our panelists also. Pakistan faced the floods in 2022 and also in 23 in some areas also. So it was a big crisis, and how we managed those in those areas, the health as right-based health. So we need to think about these areas also. So, and very important is these are the few glimpses of very core issues which needs to be addressed in health as well. For example, the gender-based violence, it is 1 in 3 women worldwide will experience the gender-based violence, either physical or mental, in her lifetime, which needs to be protected. And this will be human right violation, and in the health sector as well. And individual has the informed consent and treatment right, and which should be given to them. For example, usually it was like sometimes while doing the surgeries which are unnecessary, sometimes in low middle income countries, the individuals don't have the right to say, and we need to advocate that. And as mentioned earlier, the child marriage is a very big factor for the women's health discrepancy, health disparities, because, and also it is a increase the risk of violence and abuse. So that is the factor which really for the maternal health, this is very important factor, because many of the diseases which many of the risks for the maternal health are enshrined in child marriage. And youth health, Pakistan is having a youth bulge. So we need to think about, or there is they have the right, and it should be prioritized in every policy in at Planning Commission or the Ministry of Health or all the other concerned ministries. So, and access to contraception is considered also as a right to improve the health outcomes with the direct benefits for individuals, families, communities, and the wider society. So, and maternal health is the most important. I think it is a right issue also, because Pakistan has in maternal mortality of 186 of over 100,000 live births, which is quite high, and it is disparate in the different regions of Pakistan. We need to look into it, and it requires the empowerment and respect for the rights of the women and girls, and provision of a full range of reproductive health services to the women to protect the maternal health. So what is the public responsibility? What is our responsibility to raise, to get this right, health as a right? So what is this? This is our collective responsibility to make our decisions. We should know about our health, and we should make our decisions. We should raise our voice. We need to protect your right to health as a basic human right. We should advocate and organize in communities, and organize your community as well. And we need to promote the right to health as an intrinsic pillar of our broader human rights. We need to prioritize the health. And what is the government responsibilities? Government's interventions are to make the laws, to legislate, to finance, to bring justice, to ensure the decent work environment, to ensure the access to the social protection, which is very, very important for the lower middle income countries. And Pakistan, luckily, is providing social health protection, which is a quite a large number to a large number of population, and which is making a difference also. So this social protection will reduce the vulnerability, discriminations, and it impacts it counteract the negative impacts of unexpected life events on income, wealth, or health, like climate change events, as well as the conflict situations. So government has to invest in health, deliver on the right to the health-based approach, and be strategic or reorientate the health systems around the primary health care. And it has to be transparent. Health system has to be transparent and accountable, uh, and general public has to be involved in the decision making. So as I said earlier, this is the public responsibility also to raise their voice and know the health needs of population according to, and strategize accordingly, and safeguard for example, in Punjab it may be different, or in provinces in other provinces it may be different needs. So, and safeguard the right to health in war and conflict also. So, and also the emergencies. So thank you very much. So I think this was just an overview for our discussion to take it further. So now there is a small video, audio video display, which we prepared from different walks of the different on the comments of the different people and views of the different people in different like students and other people. So this will give us what is how we are aware, how well we are aware about the right, health as a right. So Hamza, can you please play on that? Thank you very much.
Mizan Zara Khwaja. As a bipolar patient, for me, my health, my right means managing my illness in a good manner in both the public and the private sphere. This means taking care of the manias, that is the high phase, the euthymias, that is the normal phase, and depression, that is the low phase, with the help of antipsychotics and mood stabilizers. I have been doing this since the age of 17 and I am now 40. I have also written the first book on bipolar in Pakistan called Mad Not Stupid to inform others about what it is like being a bipolar patient in Pakistan. Cognitive-based therapy, CBT, helped cure my phobias, and other things that can help you out in bipolar are journaling regularly, yoga, prayer, meditations and affirmations using apps like Headspace or Calm, soothing music, as music can be a trigger for bipolars, patients like me, and other online platforms, knowing your triggers, a good and regular sleep cycle, analyzing your dreams, and lastly, but most importantly, minding your own business, which few of us do in Pakistan. Culturally, in Pakistan, there seems to be nothing wrong with calling someone crazy, but kindness is the need of the hour. And we should be kind to mentally unwell people, as each one of them is fighting an inner battle and inner demons. Awareness about mental health issues and treatment and removal of stigma are the key areas where work needs to begin. Thank you.
Assalamu alaikum. How health is my right. Good health is essential for the enjoying a high quality of life. It enables over the pursue our goals, engaging the activities of our enjoyment, and participate fully in society. When our healthy and we are better able to contribute to our society and economy, we contribute the high productivity. We good health enhance the productivity and the economic goals.
Health as a fundamental right underscores the interconnectedness of our global community. In an increasingly interconnected world, diseases know no borders, and the well-being of each individuals impact the health of society as a whole. By prioritizing access to health care for all, regardless of socioeconomic status or geographical location, we foster a more resilient and sustainable future for generations to come. Embracing health as a right is not just a moral imperative, it's an investment in the collection, prosperity, and well-being of humanity. Thank you.
Health as a basic human right. When we talk about health as a right, we are not just talking about the healthcare facilities or access to healthcare. We're even talking about the environment that we live in, because it's my right to breathe in clean air, because as long as I have the clean air, I'll be healthy. As long as I have the clean drinking water, I'll be healthy. As long as I live in a hygienic condition, I'll be healthy. But if the environment is injurious to health, if the hygienic conditions are not met, the health of the people will deteriorate, it will be adversely affected. So in my country, there is still a lot to be done about the healthcare rights, but as long as we don't recognize the healthcare rights, there won't be any progress. So health should be recognized just as we recognize other rights, right to life, right to property, right to the other stuff. Health should also be among those basic rights. Because obviously, when we talk about the right to live, of course, if we will be healthy, only then we will be able to survive. So the world needs to realize that every person has a right to be healthy, and that can only be done if the world works on environmental conservation and improving the environment, improving the water quality, improving the hygiene conditions in the cities, improving the solid waste management and so on. So I would like this forum to propagate as much as possible for the provision of basic healthcare facilities to the people, and the basic environment that is necessary for a healthy body and a healthy mind.
Assalamu alaikum, ladies and gentlemen. My name is Dr. Aruj Akil, and I am grateful for giving me opportunity to speak at this platform. So, in my opinion, to consider right to health underpins in the aspiration of health for all, which encompasses the equitable access to quality health care for every individual without any significant financial hardships. This concept of health for all, based on equity, prevention, community well-being, and political will. So if we see in context of Pakistan, the pursuit of health for all remains a critical goal. And in order to achieve the health for all, Pakistan has demonstrated a strong resolve to deliver on promise of health for all through universal health coverage. And also the main priorities of the country is provision of the essential health services, and by providing these essential services at primary healthcare level, we can strengthen our healthcare system, which ultimately will providing or attaining the goal of health for all. And when we achieve this health for all goal, the health becomes a fundamental right for everyone.
Ms. Bahan is here, and I'm honored to speak on this important discussion on my health, my right. Health as a right is not merely a concept, it's a foundation for equitable society. It means that access to healthcare is a fundamental human right, and it is not a commodity to be distributed based on the wealth or status. So, every individual, regardless of their background, deserves the chance to live a healthy life. My health, my right underscores the critical need for universal health coverage that ensures all people can access the health services they need without any financial hardship. So it's basically about preventive care, treatment, palliative care, and it's more importantly the mental health being as an important physical health. But beyond access, the right also calls for the equality in the healthcare services we receive and a quality. It's not enough to have healthcare services available. It must be effective, safe, and respectful. Reflecting my core beliefs, it's clear that right is a health and is intertwined with other human rights. It's about dignity, equality, and justice. Health is a right, empowers us, and gives us agency over our bodies, and importantly, it lays the foundation for a productive and happy life. So let's carry this message forward, not just in words, but in actions, as we work towards a future where my health, my right is a reality for every person around the globe.
Assalamu alaikum. I am a teacher, and according to a teacher, I understand that healthy students are always intelligent. Health is very important. If there is no health, then the ordinary target to achieve in life is left with how to gain health. It is the responsibility of our government and the institutions to provide every human being in the society, either children, adults, old age, or other members of society, to provide with equitable access to medicines, to healthcare facilities, to hospitals, and each and everything. So, in Pakistan, we see that it is not being achieved so far. There is lack of facilities in government hospitals and in public sector institutions. People have to buy all these things by out of cost expenditures. On Health International Day, it's my message to our institutions that procurement for the medicines must be increased and the facilities must also be increased for the public. Thank you.
मेरा नाम सालिया अनायत है और मैं गवर्नमेंट स्पेशल एजुकेशन सेंटर निश्तर टाउन लाहौर में एज ए साइकोलॉजिस्ट काम कर रही हूँ। मैं स्पेशल एजुकेशन डिपार्टमेंट में पिछले तकरीबन 15-16 साल से काम कर रही हूँ और मैं वर्ल्ड हेल्थ डे के हवाले से लोगों को यही पैगाम देना चाहती हूँ कि सेहत है तो सब कुछ है। अपनी हेल्थ को इम्पोर्टेंस दें और अपना ख्याल रखें सब लोग। और फिज़िकल हेल्थ के साथ साथ पहले आप अपनी मेंटल हेल्थ को इम्पोर्टेंस दें। बीइंग अ साइकोलॉजिस्ट मैं ये कहना चाहती हूँ कि मेंटल हेल्थ की इम्पोर्टेंस फ़िज़िकल हेल्थ से भी ज़्यादा है। अगर आप मेंटली ठीक होंगे, स्ट्रेस फ्री होंगे, तो डेफिनेटली आप लोग एक हेल्दी लाइफ गुजारेंगे और जिस्मानी तौर पर भी सेहतमंद होंगे। थैंक यू।
Health is more than just a privilege. It's a fundamental right that shapes my existence. Access to healthcare ensures that I can pursue all my life dreams. I can be with my family, quality time with my family, and I can pursue my dreams in education and in the job. It's about feeling empowered to live life to the fullest and not being constrained by some illness or any health issue. Protecting these rights ensures that I, along with everyone else, have the opportunity to lead a fulfilling and meaningful life and encumbered by the limitations of a poor health. Thank you.
Health is a fundamental human right. It transcends borders, cultures, and socioeconomic statuses. It is the cornerstone upon which individuals can build fulfilling lives and pursue their dreams. However, achieving universal health coverage and promoting health literacy are crucial steps towards ensuring that this right is accessible to all. When individuals have access to quality health care, they can lead healthier and more productive lives, contributing positively to their communities and economies. Universal health coverage is not just about providing medical treatment when someone falls ill, but it also encompasses a comprehensive approach to health that includes preventive services, health promotion, and addressing the social determinants of health. Having said that, promoting health literacy is essential for empowering individuals to make informed decisions about their health, and it goes beyond the ability to read and understand medical information. Governments, policymakers, healthcare providers, civil society organizations, and individuals must work together to dismantle barriers to healthcare access and ensure that everyone can realize their right to health. This necessitates investing in robust healthcare systems that are accessible, affordable, and of high quality. This can be done by prioritizing primary healthcare and preventive services to address the root causes of illness and integrating health education into school curricula and community programs to equip people with the knowledge and skills they need to make healthy choices. As we strive towards these goals, let us remember that health is not a privilege reserved for the few, but a right inherent to all. We should never let go of the fact that it is in our hands to create a world where everyone has the opportunity to live a healthy and fulfilling life. Together, let us build a future where health is truly a universal human right.
Assalamu alaikum. My name is Musaddiq Nawaz. I belong to JPK. About the health, healthy man or healthy human being can be a better perform his duties accordingly. And the second thing, what government should do in the health sector, every citizen of Pakistan should prevail the health facilities. They should extend it to the rural as well as the urban areas of Pakistan. KPK government now have taken the initiative. They are providing health facilities to all the residents of KPK without incurring any cost through insurance health card. They are using CNIC, your identity card, as health insurance card, and they are covering also the serious diseases in this insurance coverage.
अच्छा जी, माई हेल्थ माई राइट पे अगर हम बात करें तो मेरा ख्याल है ये बेसिक राइट है. इट्स बेसिक राइट फॉर एनी सिटीज़न और इट इज़ रिस्पॉन्सिबिलिटी ऑफ एनी स्टेट के वो अपने सिटीजन्स को बेहतरीन हेल्थ फैसिलिटीज़ दें और एनवायरनमेंट अच्छा दें. और हेल्थ के सिलसिले में अगर हम चैलेंजेस की बात करें तो मेरा ख्याल है जो आपकी पोल्यूशन है, वाटर पोल्यूशन, एयर पोल्यूशन और इस किस्म की जितनी पोल्यूशंस हैं वो सबसे ज़्यादा बड़ा चैलेंज है हेल्थ के लिए, और जिसमें बहुत सारी कंट्रीब्यूशन जो स्टेक होल्डर्स करते हैं उनकी तरफ से भी थोड़ा सा कंट्रोल होना चाहिए. और अगर हम स्टेट की बात करें तो स्टेट की ड्यूटी ये है कि वो हेल्थ फैसिलिटीज़, हेल्थ इंफ्रास्ट्रक्चर हो गया या बाकी मेडिसिन्स और सर्विसेज वगैरह वो अच्छी होनी चाहिए. ये बेसिकली हर बंदे का, हर सिटीज़न का बेसिक राइट है हेल्दी लाइफ के लिए. तो मेरा ख्याल है कि माई हेल्थ माई राइट को हम जितना ज़्यादा अवेयरनेस वगैरह के लिए प्रोमोट करें इतना ही ज़्यादा इसका पॉजिटिव और अच्छा तरीके से असर होगा जी. थैंक यू.
Thank you for playing this video. I think everyone must have observed about that everybody has talked about the entitlements more and about what should be there and what should be provided. But how to demand that and how to increase the demand and how to participate in the government decisions to advocate their right towards health. I think very few people has talked about that. So this is the perspective I wanted to show, that everyone has their own perspective about the health as a right. So that is through this webinar or through this discussion, I think we will come up with some policy policy paper which can be based on the demand side, which will be advocacy from the demand side as well. So now we are joined by our esteemed panelists, all the panelists, thank you very much. And now we have Dr. Ali Razak, who is heading, I think, who is the chief executive. Dr. Ali Razak has joined? Not yet? He said he has joined. He's there? Okay, so Dr. Ali Razak has joined us. He is as Chief Executive Officer of the Punjab Health Initiative Management Company with a significant experience being a medical doctor. His additional qualifications include the master's degree in health planning and financing from London School of Economics, political science and postgraduate diploma in hospital and health services administration from London, and executive program from Harvard School of Public Health. As an expert on in his domain, he has previously served as a project director of different public sector health projects, which include the Punjab Aid Control Program, to the Regional Strategic Interventions Advisor, UNAIDS Regional Support Team, Cairo as well. So he is heading the largest social health protection program in Pakistan, which is the Prime Minister National Health, which is the social health protection program, and in Pakistan, in Punjab, and he has been working on it, and he has given many innovations to this program. And as this program was targeted earlier, but it became universal in Punjab, and it was successfully running. So now we invite him. Thank you very much, Dr. Ali Razak, for joining us. And my just a view question will be that how do you see how this health rights, how this program is in line with the rights-based health approach, and how it is making a difference in the health of the people and improving the health indicators in the province as well. And also a social protection or the financial protection is a very like a basic principle of demanding for the rights. So how it is fulfilling that part of the program, that part of the demands from the demand side. Over to you, Dr. Ali Razak, please.
Assalamu alaikum. Can you hear me?
Yes, please. Thank you.
Okay, thank you, Dr. Razia. Before I share my presentation with you, I would just like to say that Government of Punjab is fulfilling its commitment to achieve universal health coverage. The budget allocations and different projects for provision of quality of health services to the population of Punjab is an indicator for government's commitment. Government of Punjab, through health card, has given the right to avail the health services to its population. When we use the health card, is a health insurance program, and presently CNIC is our health card. Sehat Card in Punjab has played a pivotal role for the population of Punjab for improved access to health services. Can I please share my presentation? G, is it visible, G?
Please go ahead, please.
Oh, go ahead. Okay, next, please. Basically, barriers faced by the population to avail healthcare services is because of unaffordability, catastrophic health expenditure, out-of-pocket expenditure, and long waiting lists, as per survey done by WHO for health insurance in 2017. Next, please. These are the health service delivery challenges. Basically, we need to do much more and build stronger partnerships to improve health service delivery and through availability, accessibility, affordability, and quality of care by addressing these health service delivery challenges. Next, please. Considering health as a right, we have designed Sehat Card program with these objectives. It's basically to provide health insurance for indoor healthcare services to all citizens of Punjab. When I say indoor healthcare, it's only for indoor patient treatment, and basically to reduce out-of-pocket expenditure on indoor healthcare services and to reduce catastrophic health expenditure of beneficiaries with this program, and to implement equality of healthcare services across the Punjab. And not only that, we have basically the private sector has grown. There's a new way of health financing that builds upon the strength of private sector. 110 million, basically the population that we cater to through this program of Punjab. The total health budget for Punjab is 468 billion. Percentage increase in health expenditure in last 3 years is 100%, and health as a percentage of total budget is 15%. And in this, 51% are male, 49% female, and 43% children. This is the health insurance journey in Punjab. It started in 2016, and it was started for the people living below poverty line, when you see 32.5 PMT score as per NSCR, the Registry of Benazir Income Support Program. We started with 13 districts, and Panel Hospital was 99, and benefit package was up till 600,000, and only 7% population were covered. And then the second phase all transgender and persons with disabilities were registered with NADRA, and same population, 32.5 PMT. And we did pilot for universal health insurance for the permanent resident families of Sahiwal Division and DG Khan. And at the same time, we were covering 36 districts of Punjab for the poor population, that is less than 32.5. And the universal health insurance started from January 2022. And we were covering 32 million families, and all 36 districts were for phase 2 were also covered. At the same time, we started through this program. Basically, we empowered the population to avail healthcare as a right. Next, please. This is the benefit package of this program of universal health insurance. It's basically 1 million, 1 million, and we have divided into high cost priority care and low cost secondary care. Basically, 400,000 per family per year is for the high cost, and 60,000 per family is for the low cost. Low cost is basically all medical and surgical ailments, and if this is exhaust, then excess of loss is triggered. That is 40,000 for low cost and 200,000 for the high cost. And if still patient is under treatment, and if he needs more money, reserve fund is triggered. That is 300,000 per family per year. Reserve fund is basically for the continuation of cancer treatment, for kidney disease treatment, with basically dialysis and kidney transplant. And if cardiac treatment goes beyond this limit, this reserve fund is triggered. Next, please. We used to have more than 865 impaneled hospitals for this Sehat Sudhar program. But for the quality of care, excuse me, for the quality of care, we reduced to 206 public sector hospitals and 160 private hospitals. And these private hospitals, public hospitals are regular, have a regular license from Punjab Healthcare Commission. We work in close collaboration with Punjab Healthcare Commission, and basically these hospitals, they work 24/7 hours. These are the facilities, and basically we have more than 43,000 beds in public sector and more than 23,000 beds in private sector. And the implementation responsibility is with our implementing partner, that is State Life Insurance Corporation of Pakistan. We have signed contract with this program of Sehat Sudhar program with State Life Insurance after a procurement process, very transparent process, where many other private insurance companies were part of this, and State Life won this project. To date, more than 6.6 million patients have availed treatment, and it had cost us more than 152 billion since inception in 2016. But you can see 2016, 17, 18, 19, that was poor, that is people below poverty line, less number of patients were have availed the services. After its universal nature, which started in 2022 from January, you can see in this bar chart more than 2.4 million have availed services and costed us 54 billion. And last year, nearly 30 lakhs beneficiaries availed the services and costed us 70 billion. And this year, in first 3 months, more than 500,000 patients have availed services, which has cost more than 10.5 billion. The big number of admissions shows that this program is serving people for their right of health. Next, please. The overview, I'll give you overview of this financial protection under Sehat program is the Sehat Solar program is providing financial protection to all the permanent residents of Punjab, which is nearly 32 million families as per NADRA. The number is 112 million individuals. As per insurance model, we are paying upfront premium to our insurance company on a yearly basis. This is the third financial year of this program, and the primary objective is to mitigate the risk of catastrophic health expenditure faced by households during time of illness. The program comprehensive coverage includes essential health services, reducing the need for individual to pay out of pocket for basic health needs. Every permanent resident of Punjab is given access to healthcare services through our program. The effect on out-of-pocket expenditure. The Sehat Solar program has substantially reduced direct out-of-pocket expenditure for healthcare services for inpatient. In 2016, out-of-pocket expenditure was close to 67%. After this program, it has decreased steadily. And in 2000, last financial year, 1920, as per National Health Accounts of Pakistan, out-of-pocket expenditure is about 55%. And it's particularly for inpatient, out-of-patient in Punjab. And the burden has reduced to 14% from 24% in 2014. After the launch of this universal health program in January 2022, out-of-pocket expenditure, patient care will further be reduced. And under this UHI program in Punjab, we have paid more than 75 billion against last financial year 2022 to 23. And this program from January 2022 to date, in last 2 years, we have paid 126 billion as a claims for these beneficiaries. The Sehat Solar program has been particularly beneficial for expensive and recurrent treatments such as dialysis, oncology, cardiology procedures, and trauma-related cases, which have led to a significant reduction in out-of-pocket. Thank you very much. And can we have any question answer session, Dr. Sahiba, before I have to leave for another meeting?
Thank you, Dr. Ali, for enlightening us about this program. Yes, I have a small question. You said that you have reduced the number of private hospitals, and the Punjab Healthcare Commissions are you are working with them for the quality of care. But for the large population of Pakistan, the private sector is very important. And one of the barriers to the right-based healthcare is the private sector as well, as I mentioned in my program. Like, for example, the tobacco tax programs and tax and advertisement and all these things. So that applies to the private sector as well. So how we are dealing with this, like their high fees, high demands and everything, how you are incorporating it into your, I understand that you have the packages on that, but how, for the broader perspective, how the private sector should be controlled and the patient should get the equitable care at the low cost generally. So is there any idea on that, please, from your experience? Thank you.
Sure, it's a very important question. And the main thing is the quality is one of the need. We have to ensure quality of services are provided. Basically, when we had more than 665 private hospitals, as per Punjab Healthcare Commission and our monitoring, these small hospitals were not providing that quality of healthcare to poor patients. And most of the patients coming from far-flung districts, complicated cases, were coming to our teaching hospitals. And because of that, we ensure that we have to ensure quality, and for that we reduce the number of private hospitals. But at the same time, Punjab Health Commission has given time to these small hospitals to improve themselves, and more than 70 hospitals have already applied to Punjab Health Commission to get their regulations. Basically, initially these hospitals were only registered with Punjab Healthcare Commission and they had provisional license. So we are ensuring minimum service delivery standards are met through this intervention. So a lot of these hospitals have improved their infrastructure and the quality of services, and soon Punjab Healthcare Commission is going to provide them regular lessons. Only the regular lessons issued by Punjab Health Commission are impended with us. So it's in our mind, and not only that, with these few interventions, we have also taken new interventions by we are introducing gynecology services in basic health units and rural health centers as well. I think this basic thing was the quality of services. That's why we reduce the number. But at the same time, we are going to have more hospitals who are impelled by it.
Yeah, thank you. I think Punjab Healthcare Commission and can play a role in this quality if they are empowered, and the licensing is I think that tool can also bring the quality upwards, and also private hospitals can also provide the equitable services also. Thank you very much. And now we have Dr. Shehzad Ali Khan, Vice Chancellor, Health Services Academy, and he is the authority on the public health. And I think my introduction will not encompass his qualities and his achievements. He is a well-known. Thank you very much, Dr. Shehzad Ali Khan, for joining us. So he is nationally as well as international acclaimed scholar in public health, and he has many contributions in towards health systems and outside the health system also and the social health protection system was also he was part of the part and leading the team when it started. And now I will like to ask, are you there, Dr. Shehzad?
जी जी बिल्कुल मुझे आवाज आ रही है. Thank you.
Okay, thank you. So, Dr. Shehzad, thank you very much for joining. And I think your understanding on treaties and the entitlements and the freedoms for the treatment is very I can say it is a standard, and the way you understand these issues is we would like to ask about the how the health rights of the persons with disabilities are protected in Pakistan through legislation, as well as through and as it needs multi-sectoral involvement. How we are working, how we are at the on the health rights of the persons with disabilities, how the ministries and the academia and all the sectors which are required dealing with it, and your thought on that. So are we responding well? Is it a right based, or is it we are really making the difference? Thank you.
Thank you, Dr. Razia. There are a few points to be considered before proceeding on the topic of this right-based approach for the disabled. Even with even a normal family who does not have a disability, I feel when it comes to health right, or when it comes to health access, and when it comes to medical relief, they feel handicapped. They also feel similar to what a disability feels like. And to elaborate this more is Pakistan's health system is mostly biased towards urban settings. So like Ali Razak Saab mentioned کہ پورے پاکستان سے, پورے پنجاب سے لوگ جو ہیں وہ بڑے شہروں کی طرف رخ کرتے ہیں جب ان کو علاج کی سہولت چاہیے ہوتی ہے. تو ایک تو بہت بڑا ڈائلیما پاکستان کا یہ ہے کہ پاکستان کا جو ہیلتھ سسٹم ہے اٹ از پرو اربن. سو پرو رورل جو ہے وہ ایک نامینل سا, اس کو میں اکثر کہتا ہوتا ہوں, بلکہ بہت سارے لوگ اس کو کہتے ہیں پور ہیلتھ سسٹم فار دا پور ہے. رورل ہیلتھ جو ہے ہمارا وہ پور کے لیے پور ہیلتھ سروسز ہیں, کوئی کسی خاص کوالٹی کی نہیں ہے. بہت کوشش ہوئی ہے اس کو ریفارم کرنے کی, لیکن ابھی تک وہ کسی لیول پہ نہیں پہنچی. تو ایوری باڈی ان ہیلتھ نیڈ ٹریولس ٹورڈز اربن سیٹنگ. سو ون bias in health system of Pakistan is that it is only based in the urban areas and not just all urban areas, some of the big urban areas. آپ 4-5 نام لے لیں پنجاب کے شہروں کے, کے پی کے شاید یہ 2 یا 3 یا 4 نام لے لیں گے آپ, ایبٹ آباد, پشاور, میکسیمم مردان, اور باقی ضلعوں کو آپ بھول جائیں. مطلب 38 ضلع ہیں, 36 ضلع ہیں, تو 4 ضلعوں میں یا 5 ضلعوں میں اچھا میڈیکل سیٹ اپ ملے گا آپ کو اربن سیٹنگ کے اندر بھی. اسی طرح سندھ اگر آپ دیکھ لیں تو 4-5 شہر ہوں گے پورے سندھ کے 23-24 ضلعوں میں سے کہ جہاں پہ اچھی سروس. پنجاب میں بھی آپ میکسیمم کتنے, لاہور, سیالکوٹ, گجرانوالہ, فیصل آباد, راول پنڈی, ان کے اندر اچھے سینٹر ملیں گے آپ کو. So it's a pro-urban urban setting in Pakistan. So the health system is pro-urban. Number 2 is it's pro-curative. Pro-curative کا مطلب یہ ہے کہ ہمارے جو پریونٹیو سروسز ہیں وہ بہت ہی روڈیمنٹری ہیں, پیتھیٹک ہیں. ہیلتھ پروموشن کا کنسیپٹ نہیں ہے. پریونٹیو ہیلتھ صرف ویکسینیشن کی ڈرائیوز اور انفورسمنٹ سے نہیں ہوتی. بیہیویئر چینج کمیونیکیشن, سوشل بیہیویئر چینج کمیونیکیشن جو ہے وہ بالکل ناپید ہے. تو سیکنڈ بگ پرابلم از دیٹ وی آر ناٹ اونلی پرو اربن, وی آر آلسو پرو کیوریٹیو ہیلتھ سسٹم. اینڈ دا تھرڈ ون وچ از ویری کامن, اور اس کے اوپر ابھی علی رزاق صاحب نے بھی بات کی, جس کی وجہ سے ہم نے جو ہے سوشل ہیلتھ پروٹیکشن سسٹم بنایا تھا, وہ ہے اٹ از پرو رچ. پاکستان میں امیر آدمی کے لیے ہیلتھ سسٹم بہت بہترین ہے. اٹ از ون آف دا بیسٹ ہیلتھ سسٹم ان دا ورلڈ if you have money. If you have money in your pocket, you can access one of the best services جو شاید امریکہ میں بھی عام امریکن کو انشورنس سسٹم میں یا امپینلمنٹ میں نہیں ملتی ہوگی. اگر پیسے ہیں تو آپ وہ افورڈ کر سکتے ہیں. سو پرو اربن, پرو کیوریٹیو اینڈ پرو رچ سسٹم ہے. موسٹ آف دا پیپل فیل ڈسیبلڈ وین دے نیڈ دس ہیلتھ سروس. آج کے ٹاپک کی اگر آپ بات کر لیں, ہیلتھ از اے ہیومن رائٹ اور ہیلتھ از اے رائٹ, بہت اچھا ٹاپک ہے. اس پہ بہت عرصے سے بہت زیادہ بات ہوئی ہے. کئی ہم نے اس کے اندر باقاعدہ جو کہتے ہیں نا میمورینڈم سائن کیے ہیں. بہت سارے ہم نے اس کے اندر جوائنٹ ڈکلیریشن سائن کیے ہیں 2018 میں, 19 میں. میں نے ڈاکٹر ثنیہ نشتر نے کافی زیادہ اس کے اوپر, جب ہارٹ فائل میں ہم کام کرے تھے, کام کیا. پھر کراچی ڈکلیریشن. سو دیر آر سو مینی ریفارمز, اور ایس ڈی پی آئی نے ہمیشہ لیڈ لیا ہے ہیلتھ کو رائٹ کہلانے میں. میں بہت دفعہ آپ کے پینلز میں بیٹھا جس میں ہیلتھ ایز اے ہیومن رائٹ ہم نے کیا. اس کو تھوڑا سا ڈسٹنکشن اس طرح سے کر لیں کہ یہ اتنا مشکل نہیں ہے اس پہ آگے چلنا. میرے خیال میں یہ پرابلم ہمیں اس پہ ہائی لائٹ کرتے جانا چاہیے, ایڈوکیسی کرتے رہنا چاہیے. کانسٹیٹیوشن میں 2 کمپوننٹس ہیں جہاں رائٹس کی بات ہوتی ہے. ایک ہے جس کو آپ فنڈامنٹل رائٹ کہتے ہیں, اور ایک ہے جس کو آپ پرنسپلز آف پالیسی کہتے ہیں. سو اگر ایجوکیشن 2018 میں 18ویں ترمیم میں 18th امینڈمنٹ کے اندر کیا کیا انہوں نے, ایجوکیشن کو پرنسپلز آف پالیسی سے نکال کے فنڈامنٹل رائٹ میں ڈال دیا تھا. پرائمری ایجوکیشن, یونیورسل پرائمری ایجوکیشن کو, وہ موقع تھا جب آپ پرائمری کیئر یا پرائمری ہیلتھ کیئر یا اسینشیل ہیلتھ سروسز بھی ڈال سکتے تھے. لیکن بدقسمتی یہ ہے کہ جتنے اچھے لیڈر ہمارے پاس ایجوکیشن کے لیے اویلیبل ہیں پاکستان میں, ایجوکیشن کی ایڈوکیسی کرنے کے لیے, ہیلتھ میں لیڈرشپ کرائسس ہے بہت بڑا. اتنا بڑا لیڈرشپ کرائسس ہے کہ شاید میرا خیال ہے ورسٹ ہوگا جو ہیلتھ کا لینڈسکیپ ہے, اس میں لیڈرشپ تقریباً نہ ہونے کے برابر ہے. اور ہم اکٹھے بھی نہیں ہیں, یونائٹڈ بھی نہیں ہیں, اور ایک دوسرے کے ساتھ کہیں کنسنسس پہ بھی نہیں آتے. اس لیے یہ بڑی ضروری ہے جو آپ ڈائلاگ کروا رہی ہیں, اس طرح کے ڈائلاگ ریگولر ہوں تاکہ ہم کنسنسس پہ آئیں, ایکسپرٹ لوگ بیٹھیں اور لوگ بات سنیں, اور کمبائن ایک کلوژن اور باقاعدہ ایک فورس کے ساتھ ہم بات کریں. ہمارا ایک اکٹھ ہو تو پالیسی میکر ضرور ہماری بات سنے گا. سو ایجوکیشن چلی گئی پرنسپلز آف پالیسی سے فنڈامنٹل رائٹس میں, پیچھے پرنسپلز آف پالیسی جو تھے اس میں ہیلتھ رہ گئی. اچھا, ہیلتھ بھی جو مینشنڈ ہے نا پرنسپل آف پالیسی میں, وہ میڈیکل ریلیف کے ورڈ کے طور پہ لکھا ہوا ہے. وہاں پہ لکھا ہوا ہے کہ میڈیکل ریلیف از پرنسپلز آف پالیسی میں, کہ ایک جو ہے میڈیکل ریلیف دیا جائے گا جن کو ضرورت ہے. اور مطلب فوڈ ہے, کلوتھنگ ہے, ہاؤسنگ ہے, شیلٹر اور یہ اس کے بعد ایجوکیشن ہے اور پھر کہیں جا کے ہیلتھ کا ذکر ہوتا ہے 7ویں 8ویں نمبر پہ. تو بہت ساری سروسز بہت سارے رائٹس پہلے آتے ہیں اور ہیلتھ کا پرنسپل آف پالیسی میں بہت اینڈ میں ذکر ہوتا ہے. تو اگر آپ یہ بھی لے لیں کہ آپ کانسٹیٹیوشن میں آپ کہہ دیں کہ میڈیکل ریلیف اور ایکسیس ٹو میڈیکل سروسز از دیئر, اسٹل آپ وہاں سے ایک پوائنٹ سٹارٹ کر سکتے ہیں. سو میرے خیال میں جو رائٹ بیسڈ بات کرنے والے ہم لوگ ہیں سب, ہم بجائے اس کے کہ ٹھیک ہے آپ کریں کوشش کانسٹیٹیوشن یا لا میں لے کے جانے کی, لیکن ایک بات یاد رکھیں, پاکستان کے اندر بدقسمتی یہ ہے کہ اگر کوئی چیز لا میں آ بھی جاتی ہے تو یہ کیا گارنٹی ہے کہ وہ مل جائے گی. پہلے اتنے سارے لاز ہیں, وہ کون سے امپلیمنٹ ہو رہے ہیں. انفورسمنٹ کے حالات دیکھ لیں آپ, ہر قسم کے لاز کے, رائٹس کے ہی لاز دیکھ لیں, بہت سارے کانسٹیٹیوشن میں رائٹس کا ذکر ہے لیکن کہاں پہ اس کی امپلیمنٹیشن ہوتی ہے. بہت کم ہے کہ جہاں امپلیمنٹیشن ہوتی ہے. مائٹ از رائٹ کا قانون چلتا ہے, جس کے پاس اویئرنیس ہے, جس کے پاس کنیکشنز ہیں, وہ لے لیتا ہے اپنا رائٹ. سو یس, I agree with SDPI and your stance, and I will be always at the front to include health as a basic human right, fundamental right میں اس کو ہونا چاہیے. لیکن دو چیزیں ہیں, ایک ہے ہیلتھ جو کہ میری اور آپ کی ہیلتھ ہے, اور ایک ہے ہیلتھ سروس. اس کو ڈسٹنکشن کر دیں آپ ذرا تھوڑا سا. ہیلتھ سروسز کیا رائٹ ہے ہمارا؟ ہیلتھ تو رائٹ ہے میرا. اب جب ہیلتھ از اے رائٹ کو آپ کریں گے نا تو میری رسپانسبلٹی بھی ہوگی رائٹ کے علاوہ. سو ہیلتھ از ناٹ جسٹ دا رسپانسبلٹی آف اسٹیٹ, ہیلتھ از اے رسپانسبلٹی آف دا انڈیویجول ایز ویل. اگر میں بچوں کو ویکسینیشن نہیں کرواؤں گا, میں سیف واٹر کی ایکسیس پہ نہیں پرواہ کروں گا, میں کھانے پینے کی پرواہ نہیں کروں گا, فزیکل ایکٹیویٹی نہیں کروں گا, میں ہیزارڈس لیونگ میں رہوں گا, تو پھر اسٹیٹ کیا کر سکتی ہے میرا؟ کچھ بھی نہیں. ہمارے یہاں پولیو کے قطرے پلانے کے لیے یا میزلز ویکسین کے لیے گولیاں چلاتے ہیں لوگ, تو مطلب ہیلتھ کو رسپانسبلٹی تو کوئی لیتا نہیں ہے نا اپنے اوپر. سو اس لیے یہ ذہن میں رکھیں کہ اس کو جب آپ ڈسٹنکشن کریں, نیکسٹ ٹائم کوئی اس طرح کا سیمینار ہو تو ہیلتھ, یہ ہاں بالکل ہم سب کو صحت ہماری ذمہ داری ہے, ہمارا حق ہے, ہمیں ملنی چاہیے, لیکن ہیلتھ سروس کس کو ملنی چاہیے وہ ابھی علی رزاق صاحب ڈیٹیل میں بتا گئے ہیں. سوشل ہیلتھ پروٹیکشن کا ماڈل ہو جس کے اندر ہم کام کر سکیں اور اس کو دیکھ کے چلیں. تو اور ایک اور جو پرابلم ہے پرنسپلز آف پالیسی یا فنڈامنٹل رائٹ میں, آپ کس کے ساتھ کمپیئر کریں گے ہیلتھ کو جو وہاں پہ گئی ہے؟ فوڈ ہے, کلوتھنگ ہے, ہاؤسنگ ہے اور ایجوکیشن ہے. یہ آپ کو ہر وقت چاہیے ہوتے ہیں, یہ 24/7 چاہیے ہوتے ہیں آپ کو. فوڈ بھی آپ کو چاہیے دن میں 3 دفعہ, کلوتھنگ بھی چاہیے, ہاؤسنگ بھی چاہیے. تو یہ جو ہمارا ہیلتھ کا پرابلم جب عوام کو آتا ہے نا, کیوں لوگ اس پہ زیادہ بات نہیں کرتے, ڈیمانڈ نہیں کرتے, اس کی ایک وجہ ہے. اس کی وجہ یہ ہے کہ یہ جو بیمار ہوتا ہے شخص, جب کبھی اس کو پرابلم ہوتا ہے تو اس کو وہ رائٹ یاد آتا ہے یا اس کو نیڈ ہوتی ہے. اٹس ناٹ لائک فوڈ اینڈ کلوتھنگ اینڈ شیلٹر جو ہر وقت ہمیں چاہیے ہوتے ہیں. تو اس لیے تھوڑا سا اس کے اوپر ڈیمانڈ بھی کم ہے لوگوں کی, کیونکہ جب پرابلم ہوگا تو جس کو پرابلم ہوگا وہ رائٹ کو ڈیمانڈ کرے گا. ادروائز اگر اس کو پرابلم نہیں ہے کوئی, یا وہ سمجھتا ہے کہ پرابلم نہیں ہے, ڈائبٹیز ہے, ہائپر ٹینشن ہے, بٹ دے ڈونٹ کیئر, ان کو پین نہیں ہے, جب تک پین یا سفرنگ نہ ہو اس وقت تک یہ لوگ ڈیمانڈ نہیں کرتے. جو بھی چیز پین کریٹ کرتی ہے, سفرنگ کریٹ کرتی ہے, یہ صرف اس کی ڈیمانڈ کرتے ہیں. پاکستان میں اویئرنیس کا یہ لیول ہے. تو سائلنٹ کلرز آر آن دا رائز بیکاز وی اونلی گو ٹو اے میڈیکل پرووائڈر when we feel discomfort, when we feel highly painful or stressful, تب ہم جاتے ہیں. mental health کی situations دیکھ لیں, ہائپر ٹینشن, ڈائبٹیز, کینسر, یہ سب ڈیلیڈ ڈیسیژن میکنگ کی وجہ سے ورس کنڈیشن میں ہمارے اسپتالوں میں پہنچتے ہیں, جس کی وجہ سے اسٹیٹ کا نقصان ہوتا ہے بہت بڑا. آپ کو اگر فری سروس سوشل ہیلتھ پروٹیکشن بھی دے رہا ہے تو آپ اگر ڈیلیز ڈیسیژن میکنگ کریں گے تو اسٹیٹ کو بہت زیادہ خرچہ کرنا پڑے گا آپ کے اوپر. سو یہ بائیلیٹرل ہے, انڈیویجول رسپانسبلٹی پلس اسٹیٹ رسپانسبلٹی. ہیلتھ ہوگی سب کی رسپانسبلٹی, ہیلتھ سروس اسٹیٹ کی رسپانسبلٹی ہے, اور کون کون سی سروسز ہیں وہ آپ کو سوشل ہیلتھ پروٹیکشن میں آ جائیں گے. اب آپ آ جائیں ڈسیبلٹی کی طرف, تو ڈسیبلٹی کا بہت ہی برا حال ہے. ہم جو ہمارا ایک سوشل پروٹیکشن ریسورس سینٹر ہے جس کے ساتھ میں کام کرتا ہوں, ہمارے جو ڈاکٹر صاحب ہیں صفدر سہیل صاحب, تو ان کے ساتھ ہم نے اس پہ کافی پچھلے دنوں 6 مہینے میں بہت پروگرس ہوئی ہے. اس سے پہلے کچھ بھی نہیں تھا. تو ہم جو نیشنل جو ہماری کاؤنسل ہے فار دا رائٹس آف ڈسیبلڈ, ان کے ساتھ پیپل ود ڈسیبلٹی کے ساتھ مل کے منسٹری آف ہیومن رائٹس کے اندر یہ سارا ڈسکس ہوتا ہے. اچھا, ایک اور چیز نوٹ کریں کہ جو آپ ہیلتھ کی بات کریں گی نا ڈسیبلٹی کی, تو وہ منسٹری آف ہیلتھ کے پاس نہیں ہوگی صرف, اس میں بہت ساری منسٹریاں انوالو ہو جائیں گی. پروونس میں سوشل ویلفیئر بھی آ جائے گی, پلاننگ بھی آ جائے گی, فائنانس بھی آ جائے گی, جو سوشل پروٹیکشن میکینزم ہے وہ بھی آ جائیں گے, بسٹ وغیرہ. تو اٹس ناٹ این ایکسکلوسیولی اے ڈومین آف منسٹری آف ہیلتھ. فیڈرل منسٹری آف ہیلتھ لیڈ لے رہی ہے, ٹیکنیکل کمیٹی بنی ہوئی ہے جو کہ دیکھ رہی ہے رائٹس آف پیپل ود ڈسیبلٹی ود اسپیشل ریفرنس ٹو ہیلتھ, اور اس پہ بہت سارے ہماری میٹنگز بھی ہو چکی ہیں, بہت سارے اس کے اندر پروگرس ہو چکی ہے. ابھی میں آپ کو اتنا اپڈیٹ کر دوں کہ یہ اسلام آباد جیسے شہر کے اندر بھی اگر ہم یہ کہیں کہ تقریباً 28,000 کے قریب ڈسیبلڈ ہوں گے لوگ یا پیپل ود ڈسیبلٹی جن کو ضرورت ہوگی، لیکن شاید رجسٹرڈ جو ہیں وہ 4,000 بھی نہیں ہیں کاؤنسل کے ساتھ، تو اس کا مطلب ہے 22,000 لوگوں کا ہمیں نہیں پتا وہ کہاں پہ ہیں. تو پہلا پروسیس تو یہ ہے کہ ان کو رجسٹر کرنا، پھر رجسٹر کر کے ان کو جو سروسز ریکوائرڈ ہیں وہ دینا. ایک چیز ہوتی ہے اس کو ہم کہتے ہیں ہیلتھ میں خاص طور پہ بہت اس چیز کی اہمیت ہے کہ ہم کسی کو نا ڈسیبلڈ کو اس کی فنکشنل کیپیسٹی بڑھا دیں، یعنی کہ وہ اس کو کام کے قابل کر دیں. یہ بہت امپورٹنٹ ہے. تو میں کو سمپل سی مثال دے دوں گا. اگر کسی کی ڈسیبلٹی اس طرح کی ہے کہ اس کو نظر کم آتا ہے، تو سمپل ایک اینک گلاسز یوز کرنے سے اس کی فنکشنل کیپیسٹی کتنی بڑھ جائے گی. میں ریڈنگ کے لیے گلاسز یوز کرتا ہوں، اگر میں گلاسز مجھے نہ ملیں تو میں کچھ پڑھ ہی نہیں سکتا، تو میں آفس میں کام ہی نہیں کر سکتا. اسی طرح کچھ لوگ ہیں جن کی فار سائٹڈ ہیں، جن کو ڈرائیونگ یا چلنا مشکل ہو جائے گا. سو سمپل گلاسز ہیں، ہیئرنگ ایڈز ہیں، واکنگ سٹکس ہیں، کرچز ہیں، مختلف قسم کے جو چیزیں ہوتی ہیں، اس کو ہم اسسٹو پروڈکٹس کہتے ہیں. تو اسسٹو ٹیکنالوجی پہ بھی کام ہو رہا ہے، اسسٹو پروڈکٹس پہ کام ہو رہا ہے. ہم چاہتے ہیں کہ سوشل ہیلتھ پروٹیکشن کا جو نظام ہے اس میں اسسٹو پروڈکٹس ان کو ملیں. پھر جو ایکسیسیبلٹی کے ایشوز ہیں ہماری کوئی بھی سرکار کی بلڈنگ آپ دیکھ لیں وہ ڈسیبلڈ فرینڈلی نہیں ہے. سٹیئرز ایسی بنی ہوئی ہیں، ریمپس بھی نہیں بنے ہوئے، مشکل ہے لفٹ تک بھی پہنچنا. تو بہت زیادہ پرابلم ہے ڈسیبلڈ کا. تو ان سب کے اوپر کام ہو رہا ہے. اور اس کے اندر ایک چیز میں آپ کو ایڈ کر دوں کہ ہم نے جو ایک نیا پرابلم نکل کے آ رہا ہے بچوں میں آٹزم کا، SPRC نے اس کو بھی اپنے ساتھ ملا لیا ہے. اور ہم آٹزم کے لیے بھی، حالانکہ وہ اس طرح سے ڈسیبلٹی تو نہیں ہے لیکن وہ اسپیشل چائلڈ ہوتے ہیں، ان کو اسپیشل نیڈ ریکوائرڈ ہوتی ہے. تو آٹسٹک چلڈرن کے لیے کیا کرنا ہے اسلام آباد میں، تو ہم اسلام آباد کو ایز اے پائلٹ لے رہے ہیں. ایز اے پائلٹ اسلام آباد کو لے کے پیپل ود ڈسیبلٹی کے لیے ان کی رجسٹریشن، ان کی ٹائپ آف ڈسیبلٹیز اور ان کو کس طریقے سے اسسٹو پروڈکٹس دے کے اسسٹو ٹیکنالوجی یوز کر کے فنکشنل بنایا جا سکتا ہے. ان کی ہیلتھ کیئر نیڈ کیا ہے، اور ان کی ہیلتھ کیئر نیڈ کے لیے ایز اے اسپیشل کیس سوشل ہیلتھ پروٹیکشن ماڈل میں جو صحت سہولت پروگرام ہے یا نیشنل ہیلتھ انشورنس پروگرام ہے اس کے اندر ہم ان کو ڈالیں گے. اور یہ بڑی فاسٹ ٹریک پہ کام ہو رہا ہے، بہت سپیڈ سے ریگولر میٹنگز ہوتی ہیں اس کی. تو ہوپ فلی میں فورسی کرتا ہوں کہ نیکسٹ 3 months کے اندر انشاءاللہ by the end of June, hopefully we will be able to showcase a lot of things for people with disability Islam Abad. اور اس کے بعد پھر ہم اس کو باقی ضلعوں میں، باقی جگہوں پہ ہم اس کو کر سکیں گے ریپلیکیٹ. Over to you, Dr. Razia. Thank you.
Thank you, Dr. Shehzad Ali Khan. Very well, I think, narrated. And it's very important to increase the demand. Individual has to be responsible for their own health as well. And they need to be aware what is their responsibility. Then we can demand for the right, or we can ask the government for the availability and etc. So thank you very much for these insightful discussion. And now we have Mr. Mansoor Riaz, who is representing Pathfinder, and he has the over 15 years of experience in management design and the implementation of the development of the projects. And he is currently serving as a senior program advisor, overseeing providing the leadership in the country program and projects. So, Mr. Mansoor Ali Khan, welcome. And my question to you will be regarding the Pathfinder's footprints and during the crisis or the climate change events like floods last year. And I understand that you are big in family planning, commodities, as well as in capacity building. So over to you for your views on health as a right. Thank you.
Thank you, Dr. Razia, and our guest and colleague, and thank you for accommodating us. It is indeed an honor to be here today to discuss the very important event discuss on the World Health Day. The Pathfinder International Organization, with an impressive 4-decade legacy in Pakistan, has been unwavering in its commitment to sexual and reproductive health, but our mission extends beyond that. We actively address the multi-phase challenges faced by women, ensuring their access to essential health rights. Additionally, we engage with urgency on critical issues such as climate change and the fight against the gender-based violence. Health and climate crisis extremely affect women worldwide. हमने देखा जैसे COVID-19 pandemic in particular the diverted the resources from the essential health services, the unsafe abortion, increased births and girls school dropout, and moreover violence against with women during this challenging time. To overcome this, Pathfinder is working with the provincial government, with the health department, population welfare department, social welfare department in the 4 provinces. If I say that we're working in the Sindh, in Sindh we are working in 2 projects, that is advancing the leadership of for women and girls toward better health, climate change resilience. It's a SOMI project in which we are collaborating with the academic universities. Pathfinders fostering solution development, engaging the students in workshop on climate change, sexual reproductive health, and family planning. We are also develop the community champions who lead the climate actions, empowering women and youth in palatable and sustainable challenges. Pathfinder also working with the community-based organization and to enhance the techniques and knowledge on the the equipping local water conservation techniques, kitchen gardening, recycling for resilience. As part of, as well as we are also working with the health facilities level for the disaster preparedness and management. And these are, we are working in the 15 districts in the Sindh, and one of the other provinces we are working in the one of the project in specific on the postpartum family planning and post-abortion, because postpartum family planning is a low hanging foods, और इसके अंदर जो है we are working कि हम institutionalize कर दें PPFP को, और जिसके अंदर जो है वो policy development जो है हमने अभी 3 provinces के लिए किया है, उनके PC1 के अंदर system में activities डाली हैं जिसमें वो trainings कर रहे हैं। साथ साथ जो है हम पॉपुलेशन प्लानिंग विंग और 4 प्रोविंशियल डिपार्टमेंट और साथ जो है जेके जिसमें जीबी को भी इन्वॉल्व किया है, उसके ऊपर हम SPCC एक स्ट्रेटजी के ऊपर काम कर रहे हैं, जो इसकी डेवलपमेंट अभी इन प्रोसेस है, यूनिफॉर्म कर रहे हैं मैसेजेस। एंड सेकेंडली कुछ प्रोजेक्ट जो है वो प्रोविंशियल गवर्नमेंट के पास हैं जो वर्ल्ड बैंक के फंडिंग के ऊपर है, जिसको पाथफाइंडर सपोर्ट कर रहा है। Specifically, ma'am, Dr. Razia, as you said that during the recent flood, Pathfinder played a role in providing essential life-saving drugs, including malaria medication to the provincial government across the 14 districts of the Sindh. Additionally, we established the safe spaces within the IDP camps specifically designed for the women and girls, where for the psychosocial counseling, and as well as we have also trained the facility level and the facility level providers plus the district management on the MISP, minimum initial services package, to address the disaster element in this that. Furthermore, we have provided the RUTF sachet in the flood affected areas, and nationally we trained all the LHWs where the floods in this LHW, and provided the dignity kit in all the district. They are facing some challenges on the floods. Yes.
Okay, thank you, Mr. Mansoor, for enlightening us on the Pathfinders work and commendable work on gender-based violence and health as well. So now we are, Dr. Jasim, thank you very much for joining us. Dr. Jasim is a sector public health expert and sector specialist at Planning Commission. And he's replacing Mr. Rafiullah Kakar Saab, the member social sector. So unfortunately, due to his his commitment, he could not join us. So Dr. Jasim, thank you very much for joining on the short notice. And my question, you have seen, you have listened to the discussion, and you have all the, and at the Planning Commission, I'm sure that there are a lot of activities going on, social health protection as well. And also like that is the key area where the planning is done, and all the ministries are looking forward towards you. So yeah, recently I think the Planning Commission has worked a lot on the youth, because we have a largest youth bulge in Pakistan. So I would like to ask you about how these health rights are addressed, youth health rights are addressed at the Planning Commission, and also how these are incorporated in the health and the other multi-sectoral ministries, involvement of the other ministries in this progress. Thank you very much. Thank you.
Thank you so much, Dr. Sabha, for having me, and I'm so honored to be among those very distinguished speakers and panelists, especially Dr. Shehzad and Dr. Faisal and Suleri Saab and other colleagues, Mansoor Saab. Well, to respond to this concept of engaging the youth and their rights, I would like to take you one step backward on the social nexus of the health systems in Pakistan. We talk of rights of the people, but at the same time, there's a social responsibilities that leads to the better health. And that is why health alone by one single entity cannot be improved to a greater extent. I'll give you an example. So let's say there is a department, education department, health department, urban development, environment, and so and so and so. Unless they incorporate the concept of health across the board, this will not have a greater impact. For example, to derive the rights, we need inputs, and the inputs are everything drives by the finances and the trained human resource, and as well as individuals themselves. So the social protection systems, when you talk of the right, always works with the contribution of the communities. Contribution of the communities means how the fiscal system support that. You must have seen a lot of debate on the GDP contributions, that Pakistan is spending this much of, GDP, less than 1 or 2. And then we also say that, we need to enhance. But on the other hand, the process of enhancing of your fiscal space to spend on the health, especially for the rural side, like Dr. Shehzad mentioned, and supporting the rural economies, taking into concept of the health is the need of the time. Now, how the concept of taxing for health works. Many people think, the other day I was also talking on a PTV about this concept of taxing and health, is people think they are contributing to the health, to the taxing system and the financial system of Pakistan by paying what you call sales tax, or 17%, taxes on mobiles, usage, and on electricity and on any other things. Obviously, that has its own value. But what we call the voluntary taxation is in Pakistan driving only through the forced systems, or through those what we called, those who are employees or part of formal economy. The people in informal economy needs to get the realization that your contribution based on your income is one way or the other is used for social services, which are then coming to your rights. Health and education are the two big components of that. For example, we are driving this, social protection of health in Punjab, one of the biggest programs. But where is this money coming from? Just the people money, and the people money needs to get channelized across all financial channels into one stream, so that now the bulk of your system, and then you can spend the money in a right way, focusing on promotive side, so that the burden is reduced on the tertiary care in the longer run. That's the one key approach that is need to be taken up. Now, how the youth fits into this system and what Planning Commission is doing, particularly on youth. We are doing many other things, but I'll focus on youth aspect. Number one is, the youth employment. Because everyone knows that, the social determinants of the health, education is directly associated with the better utilization and the better personal care. And education then leads to your employment opportunities. So the Planning Commission in its 5E framework, focusing on employment generation through providing opportunities to the youth in more conducive and more enabling way. One of the biggest flagship program of the Planning Commission for Youth is called Bakhtiyar Naujawan, Prime Minister program for Bakhtiyar Naujawan, internship program. It's 40,000 internship in both public and private sector. And then in especially PSDP allocation projects, 20,000, total 60,000 internships are being provided, and the project has already kick-started, and we have provided around more than 2,000-3,000 already in just 4 or 5 months. And it's the first 6 months, the result of the employment is already 80%. Those people who were provided internship were already getting an employment from the same employer, even if they're not getting job, or they because it is based on their own choices where they want to work. The program design is in such a way. But on the same hand, the youth is also providing the training opportunity through mentoring programs and interlinkages. The platform is being provided by the Planning Commission to share their experiences of how, when they are placed into banks, in any other agriculture sector, because mostly our focus is in private sector. So how they have, contributed to development of that sector, and how that sector, wherever they are working, provided them opportunity to know more about the economy and their contribution and the skill set that they're enhancing. So this is one very easy way. The youth needs in terms of health is not much, except knowing that what is a healthy way of life. And that aspect is also being covered in the program through seminars. And we also encourage the employers, to provide them a brief overview of the, what are the healthy lifestyles, because there's in certain guidelines that is being provided. And what are those principles of working, it's called a decent workplace concept. And we are engaging ILO in that, the decent workplace concept. So when the women are working, they should be provided with the appropriate separate space, separate washrooms, separate prayer rooms. And those who are married and have kids should have the breastfeeding areas, the child comfort areas, the daycare centers. This concept is indirectly not only empowering youth and also educating them, but at the same time, transforming the employers in a way that they are becoming more effective in delivering the services. So this one aspect of youth that is we are taking care of. In addition, we are also dialoguing and we are also engaging the experts like yourself and many other academic experts in, it's called, the consultative process to improve the policy environment in the Planning Commission. This is one big change that we have witnessed in last few years. And the part of that change that people like us are now working in the Planning Commission, which used to work for United Nations and, working in Afghanistan reforms. Myself was, I was the WHO advisor for Afghanistan reforms, and I came from there, to work for Planning Commission to do a bigger change and to have a more impactful role of the Planning Commission. So having said that, the right concept is definitely taken into account. There is no second thought on that, but realizing it into the broader picture is the key. Like how you realize that the right needs to be realized by some inputs, and the input needs to be consolidated, the financial input, in a way to deliver it in a more efficient way. Having said that, thank you so much for having me, and my teacher Shehzad Saab and other colleagues. I mean, it's always a pleasure to talk and to be part of such a dialogue. Thank you so much.
Thank you, Dr. Jasim, for your insightful discussion, and also the right-based, like how the rights to be realized, that needs to be. So I think thank you all. Our discussion is like, if I wrap it up. So this is that is equitable access to the healthcare is the right, and also before demanding the right, fulfilling the responsibility is before that, as the Dr. Shehzad Ali Khan has said, and also the availability of the healthcare in all the regions, rural, urban. It should not be concentrated in the urban areas only, and raising the awareness on the social health protection, and also financing health through taxes, voluntary taxes, and also the involvement of the youth in a perspective, not only as you said that they are not needing the health care, but they need employment, and which can indirectly affect the health indicators, and the healthy lifestyle. Awareness about the healthy lifestyle is important. And again, it's to thinking about how these rights should be realized, and how the individual communities should be like motivated to raise their voice and to fulfill their responsibilities. Like vaccination is 66% in Pakistan and 29% in Balochistan. So that needs to be factored in about before talking about the right. But thank you very much, all panelists, esteemed panelists, and for your time. And thank you. I think collaborations with all the international organizations, as well as with the different departments, and the multi-sectoral approach to deal with the persons with disability, as Dr. Shehzad has mentioned, is also the key message of this program. And thank you very much. And we will come back to you after our preparation of our policy paper, and we'll get your inputs further on that. Thank you all. Thank you very much, and happy Jumatul Mubarak. Happy Jumatul Mubarak. Thank you.